Hi, I'm back. Welcome back to another episode of News for You. Accurate information for our immigrant communities. Our episode today, let me regroup, sorry. Today is July 22nd, 2026. My name is Olympia Justice. I am with South Dakota Voices for Peace. And on our episode today, I am bringing you information about Project SOS. Registration is now open if you are going to need the supplies and the backpacks for your students in your home. You can register through either the banquet's website or the 211 helpline website, the 211. And also, all of their donation boxes are at Lewis, Hy-Vee's, and Walmart's since last week. If you are able to make donations of supplies, you can shop for your items at those stores, and then you can just drop them in the box at the store if you like, or you can bring them down to the downtown location of the banquet. They are taking the donations as well. All right, and here at News for You, our goal is to present accurate information that is useful to our community. Today, we will also cover information about adolescent sexual health in our state and the United States overall. The majority of our legal services clients are people under the age of 18 years old. The purpose of bringing you this information is precisely that, to inform the community, including caring adults and the young people in their lives. As I've said often, education is key in harm reduction, and being informed helps empower our community as a whole. So it is important for me to say that I'm not providing medical advice, and we are not endorsing or encouraging behaviors or actions of any kind. In our office, we come across many scenarios. Some are very delicate and sensitive in nature, and through the years, they've included our young clients' need to navigate negative outcomes of their being sexually active. Both boys and girls who are our clients have then had us walk along them after a sexual assault, unexpected pregnancy, sexual assault or rape charges against them, and the emotional toll all of this takes on them and their families. We have needed to connect them to the necessary resources depending on their situation, whether they need counseling, criminal defense attorneys, victim advocate services, medical or healthcare services, among many other services. And I feel at this point that I have an obligation and an opportunity to help other adults and the young people themselves look at the young people in our community like we do in our office. We see our young people as whole individuals who are smart and curious, and like any other adolescent or teenager, they're learning life as they go. But unlike other kids, they have different cultures and challenges, sometimes because of our diverse cultures, and sometimes because of their immigration status, financial conditions, access to health services, access to health insurance, among other factors. But my friends, one fact that we cannot keep ignoring is that teens in South Dakota are having sex. No matter their religious upbringing or their caring adults' parenting style or rules. According to the International Journal of Sexual Health, sexual curiosity begins in early childhood. Young children may also experience deep feelings of love for another child. When puberty begins, interest in both sex and romantic connection may intensify around age 10 to 13. Sexual exploration is a natural part of adolescent development. According to actforyouth.org, which is published in partnership with Cornell University, there are risk and protective factors when it comes to adolescent sexual health. Decades of research have identified risk and protective factors that influence adolescent sexual health. Risk factors increase the odds of early pregnancy and/or sexually transmitted infections, while protective factors decrease those odds. More recently, researchers have begun to explore how these factors work together to help or harm youth. When it comes to our community factors as a whole, the protective factors include communities with high levels of trust, cohesiveness, and social capital that help young people avoid risky behaviors. Neighborhoods of this kind are also supportive of positive, attentive parenting styles. Neighborhoods that offer youth many opportunities such as after-school programs, sports, trainings, support positive sexual health, including decreased teen pregnancy. As a risk factor, neighborhoods with high rates of violence, hunger, or substance use tend to have poor sexual health outcomes among their youth. When it comes to school factors, the protective factors include school connectedness of the teenagers with students and teachers and participation, as well as the academic achievement and aspirations of the young person. As family factors, the protective factors include a supportive and responsive parenting style that helps young people feel safe and enables them to plan positively for the future. This goal toward the future makes it more likely that the young person will avoid high-risk behaviors. Another factor is parental monitoring, so long as it does not become over-controlling. It helps maintain health. Another factor is family connectedness and good parent-child communication, including communication about sex, condoms, and contraception. This helps young people achieve positive sexual health outcomes. The youth who live with both of their parents are less likely to engage in certain risky behaviors. When parents express disapproval of sex in adolescence or support for contraception if the teen does have sex, youth are more likely to act on those values that are shared by their parents. And yes, the higher family income and higher levels of the parents' education are protective factors. The risk factors when it comes to family are substance use in the household has a negative influence, and over-controlling parenting styles backfire, and these lead to youth taking more risks. When it comes to peers or friends, young people have a tendency to reflect peer social norms, which may be protective or may increase risk. For example, if they believe their peers disapprove of sex, they are less likely to become active. But if they believe their peers are having sex, they are more likely to become active. When it comes to relationships, this study shows that protective factors include good communication between the couple, the young couple, and this is associated with girls using contraception. And when girls feel connected to their partner, they are more likely to use effective contraception. A risk factor is having an older romantic partner. This increases the likelihood of STIs or pregnancy. And also, frequent dating and having a close romantic relationship makes sexual activity more likely. When it comes to the individual, as like the young person themselves, having plans for a positive future and believing in the ability to control their own life are protective factors. Their spirituality or religious affiliation does help the youth avoid risky sexual behavior. Also, waiting until an older age to initiate sex is associated with better health. Their beliefs and attitudes about sex, condoms, and contraception can be protective or can increase risk. For example, a positive attitude toward condoms is protective. A permissive attitude toward sex increases risks. And having the skills and intention to use protection, as well as having the belief in their own ability to successfully use these methods, protects young people against STIs and unintended pregnancy. As risk factors, unfortunately, being lesbian, gay, or bisexual is associated with an increase in risky behaviors. Youth who use alcohol and other drugs are more likely to start at an early age and are also more likely to have multiple partners. And gang involvement, fighting, and violence are associated with risky behaviors. In a study from the CDC from 2005 to 2015, it shows that the decreases by grade when teenagers were surveyed or studied, they were all high school students. They suggest that fewer students were having sexual intercourse during the earlier years of high school. And this observation, as well as the decreases in the prevalence of sexual intercourse among Black and Hispanic students, represent positive changes among a group of students who have been determined in previous studies to be at higher risk for negative outcomes associated with early initiation. The Youth Risk Behavior Survey from the CDC, last published in 2023, says that in the United States, 31.6% of teens have had intercourse, 20.9% were sexually active, 31.6% are Hispanic teens. Of all teens participating in the study, 3% had intercourse before the age of 13, 18.3% had used drugs or alcohol before sexual intercourse, 41% had sexual contacts with both sexes, 12.4% did not use any method of pregnancy prevention, 80% did not use the pill, 32.9% used, or let me back up. 67.9% did not use either the pill, an IUD, a ring, or an implant or a patch to prevent pregnancy. Only 24% of Hispanic teens used any of those methods. And this is the staggering statistic that just blew me away. 95% of sexually active teens in the United States had not been tested for STDs. Where in South Dakota in 2021, 6.4% of sexually active teens had sexual contact with 4 or more persons, and 95% have not been tested for STIs. Also, per the CDC, in 2023, over 2.4 million cases of chlamydia, gonorrhea, and syphilis were reported in the United States, and almost half of these were among young people ages 15 to 24. The most common STI is human papillomavirus, or HPV, and it is contracted at some point by nearly every unvaccinated sexually active person. In 2023, syphilis cases reached their highest level since 1950. Among teen women ages 15 to 17, 31% receive contraceptive services. Now, the proportion of teens receiving services has been stable, but the source has changed somewhat. 2 out of 5 teens seeking contraceptive services used publicly funded clinics from 2006 to 2010, and only about 1 in 4 used clinics in 2015 to 2019. Teens are increasingly relying on private physicians, reflecting either an increase in private insurance coverage or a greater willingness to use private insurance in general. An estimated 71% of pregnancies to 15 to 19-year-olds are unintended. In 2019, the overall intended and unintended pregnancy rate for 15 to 19-year-old age group was 29 pregnancies per 1,000 females. Finally, per the same Youth Risk Behavior Survey from 2023, sexual dating violence, counting such things as kissing, touching, or being forced to have sexual intercourse that they did not want to do by someone they were dating or going out with, among students in the Hispanic community was 6%. Why am I bringing you all these numbers? Because teens need us. They need us to be open to their questions, and they need us to be there for them, ideally for prevention of adverse or negative outcomes, but also for guidance in case their decisions or actions lead them into a place where they find themselves alone and scared. I am not a parenting expert, but as a mother of 3 teen girls, I know it is important to make an effort to be present, and although it is not easy, their father and I try to leave out prejudice and judgment when our girls confide in us about something going on with their group of friends, or something going on at school, or something going on with them personally. But each teen's situation is different than many kids in our community. For example, my 3 children do have access to health services and participate in other organizations that may provide adequate resources about sexual health if they need them. They have other trusted adults that hopefully can help them if they don't come to me or their dad. But many kids in our community don't. So please share this video with other adults and young people who may need the following information about resources in South Dakota. I am going to provide you some information about a lot of offices in South Dakota, starting with the SD Plan program at South Dakota Department of Health. They have offices in many towns of South Dakota. It is Their services are open to all people of reproductive age. Like I stated, some of these teens had their first encounter before the age of 13. The SD Plan program at South Dakota Department of Health provides information, screenings, testing, birth control options, and resources to maintain a healthy reproductive system. There is also the Medical Services Program at South Dakota Urban Indian Health. They have offices in Pierre and Sioux Falls. They are open to all, native and non-natives, and they provide medical and behavioral care services. They also provide HIV prevention, women's health, physicals, child and infant care, immunizations, and other educational resources, okay? And then I did mention that 41% of teens reported having used drugs or alcohol before intercourse. There are a lot of our teens who are using e-cigarettes or vaping. So I will give you the information about the tobacco prevention program at Volunteers of America. You can call for information or go to their website. Their Tobacco Prevention Resource Center is working to reduce disease, disability, and even death related to tobacco use. And it offers quitting information and resources and plans among youth and adults. And they work toward eliminating non-smokers' exposure to tobacco smoke and just education in general about its effects among different population groups. In the same token, there is the vaccination education and advocacy program at Immunize South Dakota. Any and all of the free clinics all over the state have the immunizations for all ages, especially talking about the HPV immunization that can be administered at age 11 up until age 45. And it is important to note that the HPV, or human papillomavirus, is the #1 cause of cervical cancer, genital and reproductive organ cancer, throat cancer in the United States. So if you have not received your immunization, you can go to www.immunizesd.org and look to see where you can get your immunizations. There is the Disease Prevention Hotline program at the South Dakota Department of Health that is open to all. The number is 800-592-1861, and they provide information about sexually transmitted infections, HIV, AIDS, and anonymous reporting of these STIs. Again, with the tobacco use, the South Dakota Quit Line program at the Department of Health is for tobacco users over the age of 13 who live in South Dakota. And you can go to www.sdquitline.com. They provide telephone coaching support and quit tobacco products at no cost, okay? And there is also the Reproductive Health Services Program at Planned Parenthood in Sioux Falls. All patients are welcome. They provide family planning, emergency contraception, pregnancy testing, gynecological services, STI infection testing and treatment, among other services. The Midtown Family Planning Clinic program at Sanford Health is open to all. They provide healthcare education and STI testing for men and women in their reproductive years, so starting in the teenage years. And then there is also the Pregnancy Support Services program at Birthright. They have offices all over the state, and this is also open to all. They provide free pregnancy testing, community resource referrals, and they have the 24-hour confidential helpline service. Their number is 605-809-8409. We also will have, in a future episode, a guest who will walk us through the legal statutes in South Dakota law for sex crimes and repercussions for underage perpetrators and victims. Remember, you can always go to the helpline website, download their app, or text 211 for any resources, to look for any resources in the state of South Dakota. And please call or message us if you have questions about immigration policies, or if you need any other information. We will try to help you. Please visit our page to donate so we can keep bringing accurate information to our communities. Thank you so much for being with me today and tuning into another episode of News for You. And I will see you next week around noon.